What's the best way to fix my under eye bags? 21-year-old. As you can see from the pictures, I have a negative vector. My right eyelid is droopy and there are prominent wrinkles under my right eye and eye bags on both eyes. What in your opinion is the best choice of surgery, including the method, to deal with my problem? When I pull both eyes to mimic an eye lift as if a doctor cut a small piece of skin and just sewn it together, I see a huge nice difference. However, there is still some color to the eye. Thank you for your time.
Thank you for your question. You're 21 years old, and you stated very well in your question that you have a negative vector, you have bags under the eyes, and wrinkled skin. And then when you maneuver your lower eyelid upward, you see a significant improvement. And so you wanted to get some specifics as to what type of surgery is right for you. Well, I appreciate very much that you recognize the concept of negative vector. Basically, negative vector means that your eye is relatively prominent compared to the projection of your cheek. And as a specialist in cosmetic oculofacial plastic surgery, I've had many patients who've come from all over the world to have me repair lower eyelid retraction who have had a very similar situation where they had a negative vector. The plastic surgeon went and removed fat and skin, and the eyelid became everted or ectropion or developed something called eyelid retraction. So it is very important that you understand what type of procedure is best for you, and there are advantages and disadvantages to a couple of different approaches. What I can't do in this discussion is, of course, do a physical exam. So I'll discuss with you some scenarios. First of all, at 21, yes, you are young to have this, but in my practice, the youngest patient I ever did lower eyelid surgery for was a 14-year-old boy who had very big, prominent bags under the eyes, and everyone at school was teasing him for being on drugs. So it is certainly fine to have a lower eyelid blepharoplasty. One thing that I would probably recommend with the understanding of your age and the negative vector is the approach I would use most likely would be something called a transconjunctival blepharoplasty. This means that I would approach the fat pockets from the inside of the eyelid, avoiding any compromise to the skin as well as the muscle that is below the skin. And this way the support of your eyelid remains intact. Now the next question is, how do we make sure that the tone of your lower eyelid, which you try to create by lifting, can be approximate to what you do there? Well, it has to do a lot with the fact that you have something called lateral canthal tendon laxity. And lateral canthal tendon laxity may be a factor. I should say that you may have it, but judging by the position of your lower eyelid, it is clear to me that there is probably some laxity, or if there's a history of allergy and eye rubbing, then certainly there is some tone that needs to be restored. Now, the procedure to restore that is something called a lateral canthoplasty or a lateral tarsal strip, to be very specific of a technique, but something that I can't tell you whether or not is indicated or appropriate is whether you need some type of graft or a spacer graft in order to give you some vertical support. That is something that requires physical examination. So with that being said, it is important for you to explore your options and go to several experienced specialists, people who do a lot of lower eyelid surgery for complex eyelid procedures and have a lot of options to offer you in order to, so that you feel that the doctor knows how to handle any issues that may occur with the anatomic issues that we have mentioned before, particularly the negative vector. An experienced surgeon should be able to help you get an improvement in the overall appearance. Something else that I would also mention to you is that we employ something called platelet-rich plasma for a lot of our patients to help with the hollowness or dark circles, to improve the skin quality, to again improve the appearance. At 21 years old, without a history about allergies or other factors, I can't make that recommendation specifically. But certainly, to summarize, you have to understand the factors that are important to maintain. That includes the tone and the fixation of the lateral canthal tendon, the outer corner of the lower eyelid, and lifting it up or tightening it to reinforce it, as well as I would avoid removing any skin. That's something that may seem logical, but that's not likely to be necessary. At 21, you probably don't have any extra skin, as well as the support of the lower eyelid from the internal aspect, the vertical support. And last but not least, about skin quality using modalities such as platelet-rich plasma. I know that's a lot to digest, but I think that should help guide you as you do your research and meet with doctors. So I hope that was helpful, and thank you for your question.